Welcome, everyone, to the Inland Empire Working Together podcast. I'm your host, Paul Granillo, President and CEO of the Inland Empire Economic Partnership. And today I'm pleased to be joined by John Chapman, who is the CEO of San Antonio Hospital. Good morning, John.
Hey, good morning, Paul. Thanks for having me on.
You are a hospital CEO, and people want to hear from you on this issue of workforce. So let's start with you. How'd you wind up in a career in the hospital world?
Well, I think like many of the young students coming out of high school going to college, back in the 80s, it was, are you going to go pre-med or are you going the attorney way? And I went pre-med and finished at UC Berkeley with a degree in microbiology and another in immunology. And decided, yeah, no, I'm not going to go to medical school. I don't want to do another 7 or 8 years. What do I do? Long story short, I ended up becoming a licensed microbiology specialist through the state of California. Ended up running the University of California, San Francisco Medical Center's micro lab. Then I ran their clinical lab. Then they paid for my MBA, and I ran service lines at UCSF for 17 years. Went across the bay and was the COO, CEO for Highland Hospital for 8 years, opened their new hospital there, and then found this fabulous place at San Antonio Regional Hospital through a headhunter. And I'm like, I love that guy. It's been fantastic. Then on top of that, Paul, you probably know, I'm the regional CEO for the Hospital Association of Southern California. And soon to be chair for the entire Hospital Association of Southern California, dealing with everything that's going on in healthcare today, whether it be workforce, financials, operations, and of course the 140 plus different bills that are out there impacting healthcare today.
Yeah, no, there's a lot. There's a lot going on. Can you talk to us a little bit about San Antonio Hospital?
Sure. San Antonio Hospital, San Antonio Regional Hospital is actually over 107 years old. Not the layout itself, just as long as it's been in existence in one form or another. Today, you find a regional hospital that owns market share, even over Kaiser, Pomona. We have the highest market share in San Bernardino. We're a nonprofit. And what makes us a little different is we're independent. And also, we have no unions. It kind of speaks to the culture here in that, some places do need representation. We're very proud that we're transparent and we really have a good quality, almost family-oriented team of caregivers. In terms of numbers that you might be interested in, we see over 360 inpatients. We have the highest ambulance volume to any hospital in San Bernardino and Riverside, including Loma Linda. And we see over 300 plus patients in our EDs. And we can speak a little bit of how that translates to the need for workforce at the professional level too.
Okay. I know that I've been a patient of yours at least twice because I was out in the backyard doing things that probably should have given to a younger person. So, and the
I have
service
no
was
clue what you're talking about, Paul. Just kidding.
right. So let's dig into this issue of workforce, John. So when people think of a hospital, obviously they think of doctors, they think of nurses, um, but there are so many jobs in healthcare in a hospital setting. What are the buckets as you
Yeah,
see
let
them?
me start. You could imagine there's over, if I include physicians, there's over 4,000 employees at San Antonio Regional Hospital. Physicians make about 800 of them. Nursing makes up about 1,000. But you're right, do the math. That means I have over 1,500 other types of employees that are needed in the hospital industry. And they range in education levels from entry level jobs where someone with a high school diploma could come in Two, what we just started this month is our first physician residency program. And we partner with institutions all the way in between. So let me bucket it with high school, junior college, college, and then post-grad residency. So at the high school level, even today, we're very proud of our shadowing program where we take over 40 to 50 high school students. They actually get to see surgeries, open heart surgeries, cath procedures. No one has this type of program around. When you think of training programs, typically they're in doctors' offices or volunteering at a certain place. We want to definitely put these young individuals in depth to see what it really is like in healthcare. At the same time, we have our Randall Lewis Community High School Health Initiative, where we go out to over, 24 different high schools telling them about healthcare careers. And I'll name a few. You did already, of course, the big ones, providers and nursing. But a lot of people forget I need facility engineers, I need OR technicians, I need phlebotomists, I need clinical lab scientists, I need imaging folks who can do X-ray or MRI or CT. I have people who are responsible for infection control and running and cleaning the surgery supplies and what's called SPD. We have a whole crew who does nothing but stocking, restocking, ordering, billing, accounts receivable, accounts payable. Basically, Paul, it's one large company. If you even take off healthcare off the name, everybody needs these types of employees. So we take individuals coming out of high school. Typically, they'll do registration or EVS. If they have certification that they could get in junior college for phlebotomy, for instance, or OR technicians, we take them on. At the college level, that's when you start getting into clinical lab scientists, and we talked about imaging. At the postgraduate level is what you and I know best. That's where we're talking about nursing, nurse practitioners, PAs, and physicians. And we're so proud here that we have training lines with all the educational institutions around here to help fill that gap for San Antonio and the hospitals in San Bernardino County.
Okay, so that's an awful lot. So where, what
That's a
part of that?
mouthful.
Yeah. So of those buckets, which ones keep you up at night?
All of them. It's kind of true. But we're very, I'll tell you, at San Antonio Regional Hospital, we have the best retention rates in all of San Bernardino, Riverside, and LA counties. And the way we do that is the number of training programs we have here. So, for instance, Paul, we take over 120 new graduates. These are RNs just coming out of school. Most hospitals look for RNs with experience, and they start them right away. With these new grads, we partner them with nurses, train them for over 3 to 6 months, depending on what area they're covering. ICU, intensive care, obviously takes more training for a new grad, while med surge is more in the 3 month realm. And what that does is, even though it's more expensive for us, uh, it closes the gap where we know our experienced nurses aren't working overtime, double shifts, missing breaks, etc. And it's rewarding those young students coming out of nursing school that you can find a job right away. In fact, nursing is in such short supply, and people go, why? It pays great. Do you know nurses, the average nurse makes over $100,000. But what happens is the schools are turning away over 66,000 applicants for nursing just in the state of California because there's not enough nursing schools that are matched with hospitals who could provide that practical. San Antonio does it the right way.
So, John, I've always been impressed by the amount of outreach you do at San Antonio Hospital with our education partners. Can you speak about some of those programs?
Yes, absolutely. Again, starting at the high school level, I mentioned that we go into 20 different high schools from Ontario down to Fontana, now down to Chino, and we teach them about educational opportunities. In fact, we urge them to, hey, if you need a break before you go to junior college, if that's the path you want to take, or college, and you just want some working experience, come join us in registration, even EVS. And if that's the path you take, what we do after a year, we place these entry level individuals in other jobs so they can shadow internally and say, is that something they're interested in? And if they are interested, for instance, we have a partnership with the University of Laverne. Well, we'll pay half their tuition to get a higher education to become an OR technician or an imaging technologist or a clinical lab scientist. So we promote from within. We definitely try to keep the young talent in the community here in San Bernardino, at least through San Antonio Regional. Another example, Paul, that I think will really resonate is phlebotomy. The word drives people crazy. These are the people who actually are taking your blood when your doctor says, hey, we need a blood test. There's a skill to that. And a number of individuals want to get into it because really, you could learn phlebotomy in a 6 to 9 week program. But then what happens is they don't find work. And the reason they don't find work is because it requires them to do 200 sticks on patients. And these educational groups, especially the private ones, say you're on your own to find it. Well, look what we're doing, Paul. We're taking over 60 Chaffey High School phlebotomists every 3 months. So I'm going to get 240 phlebotomists, and we're going to train them, get them their sticks, and I guarantee you, I'm hiring most of them even as per diems. Now that they have the sticks, and even if I don't need them, they can apply to other hospitals and have that experience and training, and we keep them here in our community. I think
Oh,
it's a perfect example at the junior college level.
that's great. So you talked earlier, John, about the other roles you have, especially with the Hospital Association of Southern California.
Right.
So on this issue of workforce, you're a private regional hospital. There are other hospitals that are owned by corporations, right? So there's competition. So how do you, as a group of CEOs, work together on these issues of workforce when you're actually in competition to hire these people? How's that work?
That great question. And that's where my point was using nursing as an example. In the past, it was rob Peter to pay Paul. So that's what you mean for competition. Now we get together, whether it be Kaiser, Loma Linda, even Pomona in East LA, come to join when we talk about workforce collaboratives in our HASC meetings, our Hospital Association of Southern California meetings. And we're like, okay, stop rating everybody. Let's expand the ability for nursing schools and other healthcare institutions, not just on nursing, but ancillary training, and provide that hands-on education in our hospitals, open our doors more. So if I, as an example, University of Laverne, we talked about OR technicians. They take 20, 25 students a year because that's all they can place at hospitals. Our goal and my goal is let's get the hospitals to take 200 students. And then that college could open their enrollment not to 25, but to 200. You get what I'm saying? Then everybody wins. And it's not a competition of who can get the most valuable, limited amount of resources like it's been in the past.
So not just in the hospital world, but in different sectors that leaders that I work with, they talk about a disconnect with our education partners. Do you see that? How can we fix that? Sometimes I hear a critique that, one individual community college will come talk to you about their programs, but that's different than another community college that might be nearby. Where do you see disconnects? Where do you see opportunities for better collaboration?
Um, Again, it's what you're seeing is a silo effect. You're seeing college leaders or university leaders throwing up their hands and saying, for me to develop this program and exponentially increase the number of students for a program, I need partnerships to place these students in to learn the practical. And that hadn't been taking place until recently. And recently, to me, I'd say is over the last 24 months, right? And now people are coming to the table, and HASC is leading that effort. We actually do have a workforce development committee. And of course, I'm one of the co-chairs for that committee. And it's nice. I haven't seen this since COVID, where hospitals are collaborating together to solve a very basic need that we all have. And hospitals, why do hospitals want to do that? Well, you can imagine if there's a small amount of resources and they're competing, wages just go up like wildfire. And eventually, that's why 49% of the hospitals are in the red. So the idea is, hey, expand the number of employees out there by providing them that vocational training.
Okay. So I want to take the opportunity to talk to a hospital CEO and broaden the conversation a little bit about some of the policy issues that affect hospitals, because I think it's important for the viewers to understand those pressures. The biggest pressure has to be that the hospital um, needs to make money. You have people to pay, you have bills to pay. That needs to be a going concern. And yet we know that there's a big issue right now about cutting Medicaid. So how do you need to focus your attention? How much of your time do you spend on those policy issues?
Oh, all the time, especially with my role with HASC. And I think I can make it a good layman's explanation of why healthcare today, at least healthcare finances, is broken and it impacts you, my family, not only people who are underserved, Medicaid, or those who are seniors like Medicare. So let me take 3 minutes to answer that question. One, most hospitals are, well, let's just say there's three buckets of patients. There's those who are on state Medicaid. There are those seniors who are on Medicare. Then you have those who have private insurance, like the Anthem Blue Crosses of the world, right? Or Blue Shield. Okay. Let's start with Medicare in the middle. Medicare has been providing about 3% increases each year. But the problem, Paul, and I think you heard me speak at the last regional meeting, is the cost of labor and the cost of goods are going up 10 to 12%. So most hospitals only make about 80 cents on the dollar. They lose 20 cents on Medicare patients. Keep that in mind. Now we look at Medicaid. Those rates are even lower. And Medicaid is a conglomeration of reimbursement models, meaning the state provides some money, the feds supply some money, and then there's, let's just say, creative ways to help subsidize that just to get to the point where we get 67 cents on the dollar for Medicaid. This sounds all bad, right? You would say,
Right.
oh, you survive. This is how they survive, and this is where it's broken. Private insurance actually pay over 240% of Medicare. Hospitals are trying to break even on the only way they can, and that's with private insurance, right? So for me and you, I don't know about you, but that's where individuals are now seeing when they apply for benefits, they see you have to pay 4,000 up front before your insurance kicks in. These are your deductibles, right? Or perhaps the dollar amount to see an office visit when a couple of years ago was what, $30, and now it's $60. So this is where it's broken. Those with private insurance are basically subsidizing the healthcare industry because the feds and the state aren't raising their what the reimbursement should be high enough. That's what we're tackling with statewide and nationwide in terms of how can we make things better. Now, Medicare. My partners get mad at me about this, but if you're very efficient, you run a good quality ship. I'm very proud of our group. San Antonio breaks even on Medicare. This is why over the last 7 years, we're one of the outliers where we actually make over 20 to 25 million a year and not lose money. We're not one of the 49% hospitals. Yet, we still have over 55% federal and state payers. We should be losing money, but we're very proud of building in a model that's based on metrics, right? We do daily metrics and make sure people get out on time. We provide discharge medications at the time of discharge because we notice many patients come back through the EDs, and these are called 30-day readmits. So we do a lot regarding quality to make sure that the patient is well when they're discharged and don't come back, and they're here the appropriate amount of time. Because the longer a patient is in the hospital, the more risk they have of catching an infection. I hate to say it, it's called nosocomial infections. You don't want to be in a hospital for a long period of time, regardless of what hospital's great at. It's you have a bunch of sick people around you, things can spread. We try to prevent that. Not good. You know, if you've ever had a loved one who's been in the hospital for 3 months, they start losing their ability to walk. They get some what's called sundowners, right? They get confused. It just makes matters worse. So we're very good at doing that. But Medicaid is definitely something that needs to be watched. I go to every city council, Paul, in the area, and that's from Riverside all the way up to Pomona, and talk about the Senate bills and the Assembly bills and how they impact positively or negatively on healthcare in our region.
No, that's a great answer, John. So let's talk about the region, right? IEP is the cheerleader for the region, reminding people outside the region that we are probably soon to be the 11th largest metropolitan statistical area in the United States. We're going to pass Boston, Cambridge, 300,000 short of Phoenix, and then we'll pass them because we continue to grow by 100,000 people a year. Then we'll be in the top 10. A lot of people don't know that, but it's one of the biggest areas in population in the country. And but we suffer from a lack of doctors and nurses. So from your perspective, right, how do we fix that? What do we need to be doing better as a collective, educators, um, healthcare professionals? What do we need to be doing better to change those numbers?
Sure. So you remember I said we needed places to train, and I use RNs as an example of what we're doing here at San Antonio. Kaiser's jumped on the bandwagon and is doing the same thing. But what I'm most proud to tell you about, Paul, is physicians. When you look at the community health needs assessment, there's a lack just in San Bernardino County of over 160 primary care providers. We do that based on what the average patient population should be nationwide, right? And where does San Bernardino fit? This is why you see large volumes in emergency rooms. This is why you see large volumes in urgent care, because I don't know your experience, Paul, but I'll even tell my experience. Trying to get into a primary care physician when you're acutely ill or just getting out of the hospital, they can't make an appointment typically for 2 to 3 weeks. That's where you're going to go. You're going to end up going to the ED. So that's why San Antonio, for the first time in its 107-year history, I'm very proud that we started 2 physician residency programs that will graduate over 60 residents starting year 3 into our community. We're promising and committing that we will hire at least a third of them to expand our own family medicine practice. Our goal is to clear, if no one else is doing it, is to clear that 120 primary care physician gap, even if we have to do it ourselves, but it'd be a longer period of time. However, I know we're not doing it ourselves. There's also doing something similar. I know Loma Linda is. You will see that gap closed, which is fantastic. That's the main thing. We want to keep the providers who are going to school here, like at Western or Loma Linda. We don't want to train them for another county. We want to hire them. So what we do when we match, when we pick the residents who are going to come in as a new class, we tell them, once you graduate, once you get your licensure, I'm going to do 1 or 2 things. I am going to hire you. I am going to pay for your first 3 years, regardless of how many patients you see. So you and your family are committed. And if I can't hire you, if I have too many in my own coffers, I will definitely, through HAS, get you placed at other hospitals in our region.
That's great. John, what haven't I asked you about? What else do you want to tell the audience about being a hospital CEO, dealing with the workforce, being a major employer in the region? Anything I haven't asked that you want to mention?
I think you talked. Thank you for the my soapbox to tell you about healthcare, and the only thing I'd like to end on is, and I think Paul, you had said it right. We need to educate our newly elected leaders on the impact of laws that are or bills that are coming through that they just don't understand how it impacts certain industries in our economy. I can't tell you how many times I've gone to these city council meetings and they get an aha moment that they knew nothing about healthcare. I'm sure it would be the same, Paul, whether we're talking about any other industry that IEP helps lead in our area. I would definitely love to partner with you and present to these city councils a multi-factor industry update and education. They need to know just as much about transport and commerce as they do about healthcare. And I guarantee you, these new people coming out of city council that are into city councils just don't know anything about it. And a portion of them will end up becoming senators and in the House of Representatives. There's going to be a few that are going to do that. We need to get them when they're new, and we need to educate them on our issues.
No, I think you're right on, John, because I think, the region has its issues, but yet we continue to grow. We have great communities, but we can only do that if we have good health care, right? And so that's an important piece of the puzzle. Just as an aside, John, because I want to put together healthcare and logistics, which is one of the major things we do in the region. How long can a hospital hold out? Um, how often do you have to be resupplied?
Well, these are called turns, Paul, and to be honest with you, it really depends on the type of product, right? So if we're talking surgical instruments, the turns might be once a week. If we're talking about, IV solutions and lab reagents, the turns might be once a month. But what's most important is when we decide what those turn numbers are, we need delivery within 2 to 3 days. We can't hold off with tons of back orders for months. So commerce is very important to us, especially the reliance on the timing of deliveries.
Yeah. So the importance of the supply chain to making sure that you can do what you need to do to keep me healthy when I wind up in your emergency department there, because
You
I
got it.
fell out of a tree.
Right.
So,
And you can imagine, Paul,
John,
right? In healthcare, many of those things have most things have expiration dates. So it's not like, hey, let's get one big turn for a year. You end up losing half because these are medical reagents that have expiration dates. So that's why the turns are important.
John, I want to thank you for your time. I want to thank you for your leadership at San Antonio, but also for your leadership in the wider community, right? Making sure that people know who the Inland Empire is, and so for putting yourself out there and doing that work, I really appreciate you. Thank you.
Well, we both do that, Paul. You're a good role model.
All right. I want to thank John Chapman, CEO of San Antonio Hospital, for joining us today. Uh, look forward to our next version of the Inland Empire working together. Thank you very much.
Thanks, guys.